Warm good afternoon to you. Good afternoon to my fellow members of the panel. Um, Also to the members of the press and the public at large. I will briefly summarize the situation as it exists now in Grenada in relation to COVID-19. Now, over the past 4 weeks or so, we have noticed, we have observed a decline in the average number of cases weekly, the number of hospitalizations, the number of deaths, and we've also observed a decrease in the proportion of persons who are testing positive. Our average positivity for the week of the 19th to the 25th of October stood at 2.3%, meaning that 2.3% of the persons tested during that week came up positive. As published in our last dashboard, which was released yesterday, number of new confirmed cases was 6, and the number of active remained at 124. We had 1 death. Yesterday, we had a test positivity of around 2%. Sadly, we have also noted that the number of persons receiving their vaccines have also decreased. And I've said sadly because it means that as the situation improves, the perception of the need for protection from vaccination seems to be declining as well. Now, we have to put different things into context. By no means we are at the end of this fight against COVID. We can only look at the many examples from right across the region and right across the world. We are now emerging from this, our first wave, so we're not at the end. What should we expect that will be happening next? Well, we can expect to have low-level spread of infection for some time. Cases will spike if we create the conditions for this to occur, meaning that we abandon the public health protocols that protect us. Levels will be kept manageable if we do the right things. Hospitalizations and death, however, will continue at some level for some time because, as you are aware, at least about 75% of our population remains unvaccinated. This will be the new normal for a little while. But we have accomplished a lot in the last few days with the cooperation of many Grenadians. We have also observed an outpouring of generosity from citizens, friends, partners, both locally and internationally. And many persons have even volunteered to be on the front line with our health staff as we continue to man the response. And we continue to be grateful to everyone for their support. So we are at the end of this a brief, intense period of battle against this pandemic. We were able to overcome many of the challenges of this first wave, but what matters now is how we prepare for the future. How we do things differently to avoid repeating the mistakes of the past. We are now reopening, and we have begun the process once again of restoring the lives and livelihoods for those of us that remain. And this is a necessary process, but we are trying to do things carefully. We know that many people would prefer that we move faster, and we understand. We are doing our best to balance the desires of individuals and the need to protect the health of the community. All we ask is for the cooperation and understanding of everyone. As we reopen, we want to request the following of everyone. Please behave responsibly. Wear your mask correctly whilst in public. Wash your hands with soap and water, or sanitize them often with an alcohol-based hand sanitizer. Maintain physical distance of 6 feet where practical, and avoid all unnecessary gatherings. Get vaccinated to protect yourself should you become infected. Let's fight the virus and not each other. Let's continue to work together to rid Grenada of this pandemic and get our lives back. Thank you.